So with delayed pregnancies, sedentary lifestyle, and also other medical conditions, there is a growing trend of high-risk pregnancies, that is a pregnancy which is associated with high risk for both the mother and the baby. So let's discuss about high-risk pregnancies in our today's episode. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. Joining our discussion today is Dr. Sarada Vani, Senior Consultant in Obstetrics and Gynaecology from Yashoda Hospitals, Somajiguda. Welcome to the program, Doctor.
Yeah, thank you. Pleasure is mine.
So, ma'am, for a woman, the journey of pregnancy is very beautiful by itself. But unfortunately, sometimes we do have to face some complications for various reasons. So, to begin with, asala high-risk pregnancy ante enti?
As you said, yes, pregnancy is precious for everyone in the family. And whenever the woman announces that, yes, she's pregnant, the happy environment is around the family or in between the couple. But when the pregnancy is labeled as high risk, the family, yes, goes into the panic mode. Whenever the high risk pregnancy, it is labeled, the family should understand why it is labeled and what are the appropriate measures to be taken. To understand, it is little different from normal pregnancy, or you should think that, yes, what extra care has to be taken in that pregnancy. So there are many various conditions, like it can be like little few extra tests from the routine pregnancy, or it can go up till to the level of high level of care to be taken in that pregnancy. So what kind of high risk factors are there? First we need to identify. Then the reassurance to the family related to the mother, related to the baby, or related to the both can be counseled accordingly. To understand simply, whenever the pregnancy is labeled as high, then with increased health risk either to the mother or to the baby or both, when the health is affected in certain levels, then it is considered as high risk.
So in today's fast-paced world, the women are also career-driven, most women, they postpone their marriage to a later stage once they are settled. So what do you think the causes for high-risk pregnancy could be? I mean, is it only age-related or are there any other causes?
Age is, yes, one of the high-risk factors. Earlier days, it is like younger age women. Like they used to, the pregnancies should be like before 20. At that point of age, below 20, the woman is underdeveloped both physically, nutritionally. The bone structure is underdeveloped, the physical development is underdeveloped. Then in that conditions, the woman itself or the pregnancy itself is considered as high risk. In fact, anemia itself will relate to the pregnancy with the growth disparities, and physical development of the mother itself will be related to the growth disparities, or underage women will have risk of high risk related with preeclampsia. All these factors make the pregnancy high risk in below 20 years. But as on the pregnancies moving forward now, as the women are work oriented or their career goals and their marriage itself is delayed after 30 years and they are planning pregnancy after 1 to 2 years or maybe somewhere around 30-35 years. Yeah. So that after 30, the first risk factor that comes into play is the infertility. The planning pregnancy itself makes them difficult. After the pregnancy is there, what are the other factors play or what are the other factors make them high risk is initially starting with when their pregnancy related with stress. First comes the stress, psychological impact, mental health, all these factors they start before pregnancy only. After that they are pregnant, okay. What are the other medical conditions they place? They have high risk of developing of preeclampsia, or before pregnancy only they are having hypertension or borderline diabetes mellitus or obesity. The age itself makes them vulnerable to many other medical conditions. This directly will affect the physical and mental well-being of the baby. So the age is very important factor. Either it should not be under age or the pregnancy should not be after 30-35 years. So ideally they should have a pregnancy plan before they are going for a pregnancy, making themselves like meeting a gynecologist, having a pre-pregnancy counseling session. What are the medical conditions are there? They have to check it properly. Then pregnancy will be very smooth, easy, happy, and we can ensure the safety of the mother and the child as well.
The complications can be prevented.
Yes. Or reduced. In fact, the complications can be reduced. If not nothing, at least complications can be reduced.
Absolutely. So once you identify that a woman falls under high-risk pregnancy, so are there any special investigations or a special treatment plan that you plan for them apart from the routine checks as you do?
It again depends on the factor that is involved. So first is what every pregnancy, every couple, whoever reaches the gynecologist, the routine tests are actually done. What the routine blood test we do is a basic hemoglobin, sugar, the blood grouping typing, or the thyroid. These are the basic routine checks. Other than that, depending upon her medical condition and the medical background, what she's coming from or what she's having. If she's having a hypertension or diabetes or some kind of cardiac condition or some kind of kidney-related problems or some kind of liver problems, whichever the medical condition is involved, we as a high-risk pregnancies caretaker, we involve the other multi-specialty doctors as well. Some cardiac conditions should be treated very well, or some cardiac conditions, they say the pregnancy is absolutely not advisable for the pregnant woman. So those conditions should be well known before they are planning pregnancy, not after planned pregnancy. Then we will reach the cardiologist. Then he may say that why did you become pregnant? So it is not like that. So you have to always
pre-planned.
Yeah. In spite of some medical conditions, in spite of ongoing pregnancies, suddenly they complicate.
Yeah.
All this care can be taken care only depending upon the high risk factor what the woman is carrying.
So apart from the medical treatment, which I'm sure is the best what you can give, are there any preventive tips or preventive measures the mother can take before or even during the pregnancy for the best outcome?
As I said, every pregnancy has to be planned 3 months to 6 months before the pregnancy. So what are the changes to be done before pregnancy for the better outcome of mother, child or both? Nowadays, what are we seeing? The obesity. So first, check your BMI. Are you ideal for the pregnancy or not? Correct your weight and start doing appropriate measures according to your BMI. Lose your certain amount of weight. Do regular physical activity. And in nowadays fast pace, what is more required is good amount of sleep, building your relationship with your partner, and cut down your